Ever wondered what surgery looked like 600 years ago? Forget the brutal, chaotic scenes you might imagine. Let's travel back to the 15th century Ottoman Empire, to the city of Amasya, and meet a true visionary of medicine, Sabuncuoğlu Şerafeddin. This isn't just a history lesson, it's the story of a pioneer who was centuries ahead of his time. Born in 1385 into a family of doctors, Şerafeddin was a prodigy. He began practicing medicine at the young age of 17, learning from the best physicians of his era. For over a decade, he served at the Darushifa, the main hospital in Amasya, honing his skills and developing a philosophy that was revolutionary. He believed in careful, non-invasive treatments first, always prioritizing the patient's well-being. But when surgery was necessary, Şerafeddin was a master. He worked across numerous fields, from anatomy and pharmacology to neurology. He was one of the first to describe a surgical technique for treating severe migraines by ligating the temporal artery, a procedure that has echoes in modern medicine. He even developed his own specialized surgical instruments, including tools for removing bladder stones, a common and painful affliction of the time. Think about it. This was an early form of minimally invasive surgery, long before the term even existed. His genius is immortalized in his incredible books. The most famous is Cerrahı or Imperial Surgery. This wasn't just a text. It was the very first illustrated surgical atlas in the Turkish Islamic world. Page after page you see detailed hand-painted miniatures, showing surgeons, patients, and the exact procedures being performed. This book was a comprehensive guide, covering everything from cauterization and fracture setting to complex operations. What's truly groundbreaking is that he didn't just copy older texts. He added his own innovations and observations from 14 years of clinical practice. And in a remarkable display of inclusivity, his illustrations even depicted female surgeons performing procedures, showing that medical expertise knew no gender. But he didn't stop there. His other major work, Mücerrebname, which translates to Book of Experiences, was essentially a scientific journal. In it, he meticulously documented his own experiments with drugs, poisons, and their antidotes. He tested treatments on animals before applying them to humans, a foundational principle of modern pharmacology. He was a true experimental scientist, relying on observation and evidence rather than just ancient theories. He detailed the effects of various substances, providing a practical guide for other physicians. Sabuncuoğlu Şerafeddin was more than just a physician. He was an innovator, an author, an artist, and a teacher. His work combined the wisdom of Greek, Roman, and Islamic medicine with his own groundbreaking experiments and compassionate approach to patient care. He created a bridge between ancient knowledge and the dawn of modern medical science. His illustrated atlas, Imperial Surgery, remains one of the most important medical manuscripts ever created, offering a vivid window into the sophisticated world of 15th century medicine. So the next time you think about the history of surgery, remember the name Sabuncuoğlu Şerafeddin, a true giant whose legacy continues to inspire. Thanks for watching. If you enjoyed this journey back in time, don't forget to like, subscribe, and hit that notification bell for more stories about the hidden heroes of history. See you next time.